Hi everyone, and welcome to Atp Live Monday. I hope you've had a beautiful day already. Welcome. I'm going to just make sure I share the videos so that everybody can see and they can hear us. Good evening, everyone. Oh, Major Evans from Ilorin. Good evening. Greetings to you. Thank you so much for being one of our first to join us this evening. Welcome. So I'm just going to share the video myself and then we can start. Please also share the video, invite anybody that needs to be here so that they can be part of this ATP Live. ATP Live Monday is brought to you by Ask the Pediatricians Foundation. It's an opportunity for you to ask any questions that you have about the health of your children within an hour and get your answer straight away. So we're welcome to start posting your questions. You can start with the age of the child, tell us a brief summary of your concern about the child and what you would like to know. So this is an opportunity for you to do that. So we'll soon start, but I'm just trying to share the video. So for those of you watching on Instagram, thank you so much for joining us. For those of you watching on YouTube, thank you so much for joining us. You can just post your question directly as comments under the video for those on YouTube, on Instagram. For those on Facebook, if you're on our Facebook page, you can just also just ask your question directly under the video. But if you are watching what we shared to the groups, you have to, if you have a question, you have to click on the video so that it will take you straight to where you can ask your question. But if you just post your question directly under the shared link in the Facebook group, we may not be able to see your question. So I'm sure most of us are familiar with that by now. So feel free to start posting and asking your questions, and I will do my best to answer it in the next 1 hour that I have. So I'm also still sharing. Just give me a couple more minutes to finish doing that. All right. Okay. Okay, good evening, Shifa Girl from Abuja. Thank you so much for joining us. Is our president in Abuja today. I hope Abuja is lovely. And our condolences to people in Maiduguri going through this the flood. We pray that there will be resolution soon. Try and be safe. We'll do our best to see how we can support. And we want to thank all the agencies that have been supporting those affected by the flood. All right. So, if you have any questions about the health of your children, this is the time to ask. Let's try and ask on time today. Let's not waste time. Okay. let's just try and okay, yeah. So okay, so we'll try and do our best to answer them. All right, I can't see any question on Instagram. I can see, let me go to Facebook and see whether I have any comments or questions. Okay, no question as well. Yeah, so I think I'm done with all the sharing. I just need to pin some of them, but I'll be doing that. So, but please ask your questions now. For those who are just coming in, welcome to Atp Live Monday. I am Gbemisola Boyede. I'm a pediatrician, and my job this evening is to answer any questions that you may have about the health of your children. So feel free to ask now. And just a few housekeeping. If you when asking your questions, start with the age of the child. It's so important for us to know the age of the child, because that's how we know how to put it in context. So always start every question with the age of the child. Try and summarize what your concerns are with the child, and please ask very specific questions. And if you're asking questions about weights and things like that, it will be helpful if you tell us some of the um, measurements that you have about the child, so we will know uh, what to do. So those are a little bit of the housekeeping announcement. So otherwise, we have time now to start. Thank you so much for joining us. So on Instagram, feel free to start dropping your question. On Facebook, drop your question as well here, and then I'll do my best to answer them in the next almost 50 minutes left now that I have. Currently, I can't see any questions, so that's why I've not started answering any questions. So, but feel free to drop your questions. Okay. Seems like we don't have any questions today. That's okay. It's possible that all our children are healthy and there are no concerns about them. So that is absolutely okay. Facebook people, let me know that you can see me and you can hear me, because I'm not so sure. Facebook looks as if whether there's something hanging on Facebook. I don't know. Okay. All right. Welcome everyone. So if you have any question, it's the time to ask your questions. And after the live session, if you still have any question about the health of your children, feel free to head over to our Facebook group. We are there 24/7. Not 24/7, actually 24/6. So we are there Mondays to Saturdays, and you can always post your questions there, and we will try and answer them within 24 to 72 hours. Please just be patient with us if you post your question and we have not answered them, depending on how technical your question is. So it will determine how quickly we can answer them. All right, I got a question from Instagram, so I will go straight to it. Osa Sonia, just let me stick with Sonia. Good evening, my little one turned 11 months today. Okay, almost there. He doesn't like eating, only direct breastfeeding. I am returning to work soon and deeply worried as how to feed him while I am away. All right, Sonia, well done. Yeah, this question about children not eating is a very common issue that parents have to deal with. especially when we start children on complementary feeding, and some parents struggles a bit with it. Some children could be what we call picky eaters or fussy eaters, and I know it can be quite frustrating, but then there's still hope. Okay, so it's about being patient and being persistent. Okay, unfortunately there is no like quick fix, which is I'm sure what most parents want from the pediatrician. We wish we have something we can bottle up for you and say, okay, just give this child and the child will start eating everything. There is actually nothing like that. So it's about, because your child is 11 months old, so you should have started complementary feeding since the age of 6 months. And what we recommend is to offer the child food several times. Sometimes when you start offering food, we have a lot of resources on how to navigate this journey of complementary feeding. I don't know how much of it you've gone through. I know sometimes parents, we also just want to quickly mix something, put it and a bottle and give to the children, which is not ideal. So the other thing is to make the food and give them with cup and spoon. And sometimes you have to offer the same food like what we call like 13 times, 1 3 times before the child, before you say the child is not taking that, and then you go on. And I'm like, there are, at least don't aim to try more than one new food per week. So as you keep trying, you'll be getting across to what the child likes. Another thing is to prepare the food, make it exciting, make it interesting, make it colorful, and then make sure you eat with the child at the same time, so the child does not see eating for him as a punishment. The whole family sitting together, eating together, it also helps the children. So in that process, you'll be discovering things that the child likes, and then you can be adding that to your arsenal of meals that the child can take. And there are lots of different ways to prepare food and all that for children, depending on where you are, the kind of food you eat and all that. So it's about just being, trying all these things that you will get to know what your child likes. And sometimes when you start trying, don't aim to get the child to finish a whole bowl, because sometimes when parents say my child doesn't eat, what they actually mean is not that the child doesn't take the food at all, but maybe the child is not finishing the quantity that they packed into the food. So sometimes when you are starting, even if it's just 1 or 2 spoons the child is taking, that is fine. And then what you just aim for is that you increase the quantity, with each feed and all that. And avoid giving the child junk food, no juice, no all these pastries and all that. Make sure you're giving the child real healthy options. I would recommend that you go to either our Facebook group or our YouTube channel or podcasts, or even our website. We have all these information and resources. There's a guide on complementary feeding. We have several videos, about 5 or 6 of them, that you can watch and you can pick up principles. Even on our Instagram page, where we have lots of small flyers that we've put on tips on how to encourage your child to eat. So these are things you can do, and you have to keep doing it, and you have to be persistent, and you get there. And also, of course, your child's weight is also important. Your child is 8.9. 8.9 is not so bad for 11 months old, though we want the child to be moving closer to 10 kg by the time they're about 12 months old. So it's not too far. It's not, but we don't want it to start dropping more. We want it to be going higher. So there are tips on feeding fussy eaters, but there is no shortcut to it. It's being patient, it's about being persistent, and that is what is going to, that's how you're going to be able to get the child to get the right support, I mean, to get to start eating. So just be patient and just continue to work on it, and you will get there. And of course, we'll keep an eye on the child's weight, so that as long as the child is maintaining a healthy weight, we are happy, and that's what you need to do. So I hope that's helpful for Sonia. All right, let's go on to, it's like my people are on Instagram today. I can't see people on Facebook. I don't know, maybe there's a problem in Facebook, but let's just continue. So Urbanity. It's a good evening, ma. Thank you for always being there. Please, is there a cause for alarm? Okay. As my toddler of 17 months stomach is always hot or warm. Okay, hot or warm. So, the most important thing is to know whether is the child having fever or not. So, if you feel any part of a child's body is hot or warm, the first thing to do is to get your digital thermometer, and I hope you have one at home, and just check the temperature. Normal temperature is between at least 36.5 to 37.5. Anything above 37.5 will classify it as fever. So, if the temperature is normal, I will not worry about it. Sometimes when a child has finished eating, for example, there's a lot of blood flow to the tummy area because the food has to be digested. So there's a lot of blood flow to the intestines and all that. So the tummy may feel warm to you at that point, but other times it will come back normal. So that is not thing to worry about. But the most important is to check that the child is actually not having a fever. And if the child is not having a fever, I will not worry about it. But if the child is having a fever, then you need to, of course, do the needful to know what is the cause of the fever. Give paracetamol or tepid and all that. But more importantly, the fever persists, which is temperature greater than 37.5, then you have to see a doctor for proper evaluation, and that will deal with it. All right. Okay, Sonia, you say you're also a picky eater. Okay, so maybe it's it's genetic then. It's possible, but as long as for our picky eaters, the most important thing for us is that they are not losing weight, and we are not always too aggressive in terms of making sure they finish everything in the plate. As long as they are able to at least eat enough to live. Some children live to eat, some children actually eat to live. They just need to eat the minimum to be alive and maintain a good weight. We are happy with that. But it's about sometimes you have to do a lot of trial and errors. And if a child likes a particular food, you just give. It doesn't matter if the child wants to eat that particular food, as long as it's healthy option, of course. Want to eat it 3 times a day. It's better than, so you keep giving what the child likes, then you keep trying others until you discover another one that you can add to it, and you keep doing that until you have maybe 4 or 5 options. Even if the child wants to be eating only that, it's okay, as long as they are healthy and the child is able to, not losing weight, and the child is living healthy. That's the most important thing. All right, let's go on. Shifa girl say my 2.5-year-old has refused to poo in a potty. Okay, yeah. She only weeps, she cries until we wear her pampers. If she refuses, she will not put the whole day here. Okay, I understand what you're saying. Some children actually have that. It's a form of a sensory thing for some children. It's a sensory processing behavior. I would like to know whether does your child have other issues, other developmental issues, any speech delay, any repetitive behavior, any unusual behavior. Because if they are well, then I will recommend that the child see a developmental pediatrician for a full assessment, because sometimes these are behavior that are part of other issues, like what we call sensory processing difficulties can be part of developmental conditions like autism and all that. And so in that case, it's a different approach altogether. But if your child doesn't have any other developmental issues, and it's just that the child is refusing to pull in the nappies, so to pull out, in the potty except the nappies, then it is sensory. You can check online for some tips on what to do, but sometimes you may need to see the occupational therapist. Okay, you are saying secondly she has sensory seeking issues, protein. Okay, yeah. So I think your doctor are right. So from the more you are talking to me, the more, yes, this the whole thing you are saying is still, even the fact that the child doesn't want to put in the potty and only put in a nappy is still part of that sensory. So it's all sensory. So your child definitely has some sensory seeking behavior. What I want to know is whether is this child only having a sensory processing issue isolated, or is this child actually having um other developmental issue. Then in that case, I will recommend that you see a developmental pediatrician. If it's only sensory, then you can see the occupational therapists. They deal with sensory processing issues. Yeah. and they have some strategies, what we call like desensitization. There is a way we get the child to do it, and but sometimes it involves a lot of strategies to get you to do that. But that's what you need to do. But it's very unusual most time for sensory processing to occur in isolation. So most time it's part of other issues like autism and all that. So that's why I say you really need to be sure this child does not have that, and so because that will determine the pathway to follow. Sorry, somebody has asked a question, but the question is disappearing. Something about a stool that is sad constipation. If your child has constipation, you sometimes we have to give them stool softener, something to make the stool softer. And after that, we want you to make sure you're giving them water, you're giving them fruits and veggies. The child needs to drink water, if not, they will keep having constipation. So if you still need help, the doctors can help you with that. Okay, Urbanity is giving me an update. You said you use a digital thermometer and temperature is about 30. So if temperature is 37, that's fine. You don't need to worry. I think sometimes it's just your own feeling. And if you are doing it after the child has just eaten, then I can understand it's just blood flowing to the intestine. There's nothing to worry about. Okay, Major Evers, my baby is 2 year, 4 months old. Weight is 17 kilos. Wow, that's a lot. 17 kg is the weight of a 4.5 year old, almost 5 year old. So I really want you to see a pediatrician about that way. The child is overweight for age, and we need to know why. We need to know why. Is it just an isolated thing, or is it part of other medical conditions? And but like you rightly said, your child is eating, kids, family is small. Well, I'm not sure what that part. Is it that you're saying the child eats a lot, or is the child is only eating normally? So because everything is not only about eating, sometimes it's a medical issue, but we definitely need to keep an eye on that weight, and we need to know why, and we can see what to do. The most important thing is that please don't give her unhealthy food. All the pastries, biscuits, juice, all those things, you need to take them off completely. Her weight is too much. Yes, her doctor is complaining her weight is too much. Yeah, her weight is much for her age. And already okay, she eats a lot. You need to reduce the food that she's eating, and you need to give her healthy option. Give her more veggies, give her more of fruits, give her things that are lower carb, and try and restrict the amount, maybe 3 times a day, and snacks in between, and let her drink more of water. You need to control her intake. Don't just always give her food every time she asks for food, or you just let the food be accessible, and all that. You need to watch, you need to make sure that you are also not eliminate that. But it's also important to check that it is not just food. Like I said, some children have other medical conditions that can make them to be overweight. So you need to make sure. That's why I would recommend you see a pediatrician, preferably a pediatric endocrinologist in a teaching hospital, and then they can take it up from there, because they will know whether the child they can do some investigations to know what is wrong, and if they do it, then they can now um advise you on what to do. So it is, the weight is actually worrisome, and it's not good. Even though we pediatricians, um we worry a lot about people, children not having enough weight, but we also worry when the weight is too much as well, because both of them have issues, and we don't want anything to happen to the child, that will that will put her at risk. So please work on that. Our genotype is XS. So okay, if our genotype is XS, then so she's seeing doctors already. Okay, that's good. So the more reason, the doctors can refer her to the endocrine doctors, the endocrine specialists. Obviously, most sickles SS children tends to be on the weight. They tend to actually have low weight for their age. So if your own is having overweight, I think there may be more than we need to just check there's nothing more going on with this child, and then we can take it up from there. So if you're watching on Facebook, can you just post something? I just want to check that there's no problem with my streaming to Facebook, because I can't seem to shake the feeling that there's something going wrong on Facebook. Usually most of my questions come from Facebook, but today it's always been just Instagram. So I wonder whether there's something going on Facebook and like a technical glitch. So just let me know if you're on Facebook and you can see me or you can hear me. Just let me know, and then I can take it up from there. All right. So for those of you who are just joining us, we're just about halfway gone, and this program is brought to you by Atp Pediatricians Foundation. You can ask any questions that you have about the health of your children, and we'll try and answer them before 7 p.m. when we're going to call it a day on Instagram. But if you have any question after the live session, please feel free to um, go to our Facebook group. We are there for you 24/6, Mondays to Saturday. We'll be there all day. Just feel free to post your questions there and we'll try and answer them. Of course, we always encourage that you don't post emergency questions on Facebook or Instagram. If your child has an emergency, something affecting their airways, something affecting their breathing, something affecting blood flow, they are bleeding excessively, they are convulsing, they passed out, you have to take them to the hospital, because that is something that we have to do something about straight away. But otherwise, you can just leave your questions there and we'll try and answer them as soon as we can. So that is, we also have a group for adults where we answer questions about adult health issues, but our primary calling is to the children. So feel free to always post your questions there. And if you are interested in just learning about health of children, feel free to visit our website, www.axpediatricians.com. You can read about all these topics: immunization, feeding, breastfeeding, all those topics. We've addressed them, we've written about them. You can read on our website, and you can actually ask questions there too, and we'll answer you. Over time. Also, if you prefer to listen, you can actually go to our podcast, Ask Dr. Gbemisola ATP podcast, and just listen on Spotify, on Google Podcasts, most of the podcast platforms were there. Or if you like to watch, please visit and subscribe to our ATP TV channel, and you can also watch all the past videos, including this one. They're always available on our YouTube channel. All right. So uh, I'm still here. So if you have any questions still, I'm still here to answer. Feel free to post your question on Facebook, on Instagram, on YouTube, and I will try my best to answer them. All right. And just to remind us to make sure that we take our children for let's take our children for the immunizations. Let's make sure that, especially now that children are going back to school, let's check that their immunization are up to date. And also, let's make sure that we deworm the children. We actually recommend deworming them every 6 months. So school period is always a good time to remember to do some of these things. So just let's try our best to do that. All right. Okay, I don't have any question on Facebook. I don't have any question on Instagram, which is very unusual. Okay, but I hope there's nothing wrong with our Facebook. Okay, Sandra is commenting from Facebook. Okay, good evening, Sandra. At least thank you for helping me to confirm that Facebook is not broken, because I just wonder why Facebook have got no question for over 30 minutes, which is very, very unusual. All right. Okay. GSK Couture is asking if there's any immunization for 3-year-old. Okay. It depends on where you are, GSK Couture. When it comes to immunization, every country has what they call their own immunization schedule. So everybody has immunization that they recommend. Most countries come up with the immunization schedule based on the conditions that are of significance, things that have issues to them in that particular country. And so I will answer for Nigeria. If you're in Nigeria, we don't have any immunization at the age of 3 years. So we have immunization, most of them, in the first 6 weeks, then you go to 9 months, then 15 months, and then after that we have the after the 15 months, you get a little bit of a break until the age of 9 years when your child can now go for the HPV vaccine. However, we do give our children vitamin A. I always, because I need to quickly clarify that because some parents may not know, but children from 6 months to 5 years in Nigeria are supposed to be on vitamin A supplements. Strictly speaking, vitamin A is not immunization, but it's still something we give routinely to children because we can easily prevent vitamin A deficiency, which is a most common cause of nutritional blindness. So something that is easily preventable. So that's why we give our children vitamin A. So from even after your 15 months, they will still keep giving your children vitamin A every 6 months. But the main immunization after 15 months, when you get Mrs. 2, the next immunization will be at 9 years, where the child will be given the human papilloma virus vaccine, HPV vaccine. But if you live in other countries, please check your immunization schedule. I know some countries like UK will give preschool boosters when the children are about 3 or 3.5. So it varies from country to country. I hope that's helpful. Chifega say my 7-year-old is too emotional. He cries if I shout at him. Please don't shout at him then. He wants to hug and kiss everyone. Okay. He's so smart but plays too much. He can't sit still for a minute even in school. Okay, there are a few concerns in this comments. We don't want a 7-year-old hugging and kissing everyone. That's and I don't know whether that include family or strangers because you are not very you need to be very specific. Obviously, family members that's okay, but if a 7-year-old is going to hug strangers or trying to kiss them, that would be a red flag for me. And also, I don't know your definition of play too much, so I can't comment on that. But if a child cannot sit still, then I'm also worried about because that is hyperactive. So the question is, you can ask the teachers at school, is he able to sit still for their lessons? Is he able to sit still throughout the class, or does he have to get up, wander around the classroom, or something like that? So, if he's getting up and wandering around and not able to sit still at least for 30 to 45 minutes, subjects or a lesson, then I will recommend that you see a developmental pediatrician because they may want to do assessment for possible ADHD. That is the one that we worry about, the child who is very hyper, who does not sit still. But the issue of the emotional part, um, there are other things we need to look out for as well, before we can say, is it just an isolated thing or is there a context? So you see that most of the time, you are also the one that asks about the 2-year-old with sensory issues. So sometimes some things, if they happen on their own alone, it may not be an issue. It may just be one of those isolated stuff. But if some things are happening with a cluster of other things, then that is when it will be an issue for us. So we usually for us, that's why it's best to see a developmental pediatrician because we will be asking you questions about even things that you are not worried about, things that you are not concerned about, and that you may not even know is a problem. But we will begin to look at it, scrutinize everything, and then we can say, oh, yeah, this is a problem, or this is not a problem. So it's a little bit tricky at this point. But I really will if you're worried about it, I would say see a pediatrician again and let them do a proper assessment. But I usually would say have a conversation first with the school teacher. If the teachers are not worried about him, if they think it's okay, he's sitting still in class, he's behaving properly in class, they may just be maybe with you, it's an attention seeking thing. But if the teachers are concerned about him, then we will be concerned, because most times the teachers, next to the parent, the teachers are also the next uh, professionals to notice when children have significant issues, because they see these children every day, 8 hours or so every day, 40 hours a week. So they definitely know the children as well. And sometimes they see some things that parents don't see. So actually in this sometimes in Nigeria, professional parents especially very busy, they are out in and out quickly, so they don't sometimes even see their children. So by the time they come back, the children are playing or going to sleep. So we also sometimes rely on the teachers to tell us how is the child in school. And if the teachers are not worried, yeah, most likely maybe there may be nothing. But if the teachers are worried, then we'll be definitely concerned about the child. So I will rather say have a conversation with first with the school teachers. If they are concerned, then I will recommend you see one of us. Okay, where can I say developmental pediatrician and occupational pediatrician? Occupational therapist, not occupational pediatrician. Okay. You can in Abuja. Okay, for Abuja, you can try National Hospital Abuja. I'm sure they should have OT, they should have occupational therapists. But I also know Abuja have a lot of private therapists. So you can just Google occupational therapists in Abuja, and you may get a list of couple of them. Developmental pediatrician, Abuja, I'm not really aware of any for now, but we definitely have pediatric neurologists, and we have pediatricians who have interest in developmental pediatrics. So try National Hospital Abuja. I'm sure at least they have a pediatric neurologist who will be able to at least start some things, and they can start and evaluate your child for you, and then they take it up from there. So that's what I'll recommend here. But for the therapists, I'm sure you can get them privately, even within Abuja as well. So there should be private therapists there in Abuja. All right, just try, or you can send us a SMS on WhatsApp on or ask the pediatricians, our ATP clinics. We can offer you some uh, virtual clinics. So you send us a message, but try first Abuja National Hospital or private and see whether you can get. Yeah, there's somebody in Abuja as well. So yeah, okay. I think that's I've forgotten her surname now. Yeah, so there are a few doctors in Abuja that can do this kind of assessment. Yeah. All right. Okay. Did I miss any question? Did I jump anybody? I don't think I did. All right. Okay, I got a couple of few minutes more to go. All right, there's something definitely going on with our Facebook page. All right, so if you still have any questions, today is Instagram day. Feel free to ask your questions, and I will do my best to answer them as soon as I can. But for those of you who may be watching this program after the live session, I know some people come on to watch after we are gone. Please, if you are watching between 6 p.m. to 7 p.m. Nigerian time, yes, you can post your questions directly on the Facebook, on the platform where you're watching, Facebook, Instagram, and on so on. But if you are watching after 7 p.m., please, you are no longer live. So don't bother posting your question. Watch the video to the end in case somebody has asked your question and we've answered them. But you have to go to our Facebook group, Ask the Pediatricians Facebook group, and you can post your questions there. All right, this is Lumi Stride. Hi, ATP. Thank you for all you do. You're welcome. I have a twins who are close to 2 years now. Okay, birth weight is 1.9 and 2.2. Current weight is 11 and 9 kilos. Is this a good weight for babies? Well, your baby born preterm. You didn't tell us that. Just tell us first whether your baby are born preterm, because if your baby were born preterm, we need to correct their age first. But definitely, I'm not worried about 11 kilos for, and I'm not sure, is it the 1.9 kg baby that is now 11 and the 2.2 kg that is now 9, or is it the other way around? Because it's also important for us to know if it's the same. If the 1.9, yeah, if the 1.9 is the one that is now 11 kilos, that is okay. Usually, an average 2-year old should weigh 12 kilos, but your baby were born preterm, so we have to correct for the being born early. So we were aware they started slow. So 11 kilos at 2 years old is okay. That's fine. I'm not worried about the weight of the baby. But your 2.2 that is weighing 9 kilo, I'm definitely worried about that one. So was there any problem with your second twin? Was your second twin sick? Because that was the bigger baby, and that baby should be bigger now. And obviously, that baby, even if the baby is not bigger than the first one, but your baby should be at least getting close to 12 kilos. So 9 kg is underweight. How preterm were your babies? What was their gestational age when they were born? How many weeks was the pregnancy when you had the baby? So let us know that information first, so I can quickly do my uh, correction. But definitely your 11 kilo baby is okay. I'm not worried about that one at all. But I'm concerned about your 9 kg baby, and more so because that 9 kg baby was the one that was 2.2, which was almost normal weight at birth. So we should expect her to be closer to 12 kilos. So yeah, 31 weeks. Okay, so you were born at 31 weeks. They were born about 9 weeks preterm. So you didn't tell us how old they are, and I just said they are close to 2 years. I did 23 months for preterm babies, and for babies like that, there's nothing like they are close. Everything has to be exact. So you see, I did 21, I did 22, because we correct until they are 24 months. So we really need to have a clear number about that. So I can't even correct this because you've not told me the exact weight. But if let's say that we assume they are almost 24 months, and then you have to correct and subtract the 9 weeks they were born earlier. And even with that, your baby should be at least maybe 1.8, 1.5 years old. So even at 1.5 years old, we expect them to be at least 11 kilos. So your baby boy is fine, but the girl is below. So I would recommend that you see the pediatrician, not because we are particularly worried, but we need to start working on that weight, because if it drops lower, then we may get into trouble. So your baby is already on the weight. The 2.2 kg baby is already on the weight. So what we need to do is to make sure that we work on getting it up and not it going down. So your baby should still be seeing their pediatricians. Most pediatricians will follow the twins. I mean, the preterm babies up to 2 years, some even up to 5 years. So I would recommend you see a pediatrician. Make sure the child is eating well, increase the quantity and the frequency and the quality of feeds for the baby. And sometimes twin mothers, you kind of I hope you're not swapping them around and not knowing who you are fed, and you fed someone more than the others. I know, just make sure you are not doing that. I'm not saying you are, but these are little things that can cause issues. Okay, your baby has a digestive. Okay, all right. Okay, so that's all. Okay, you didn't tell us that information. Yeah, so now it's understandable. So she has had a problem. She had surgery. Okay, so that is possibly the explanation. So, but that baby should be under follow up for the doctors who did the operation and the dietitian, hopefully. So, Yeah, she does not eat. Okay, so you need to see a dietitian, because your baby, because the child has had operation, obviously in the, I don't know whether it's in the intestine. You didn't really say, but you said digestive problem, so I'm assuming that. So that baby may need a little bit more help to get the child to eat. So I'll recommend you will see a dietitian and possibly the surgeons, because we don't know whether, some babies have Gosha Bowel syndrome, all those kind of things, depending on what kind of operation they did. So you will really need to see them, and then they will take it up from there. But that child still needs a little bit of help. Okay. So, and at least I understood now why the child is behind the one that was actually smaller, but the child, we need to make sure she doesn't keep dropping and she can get up to where she should be. Okay. All right. Oluwa Mayomi Kun. Good evening. My toddler of 1 year always rub his forehead. No fever, no cry, just rub. Sometimes just an habit. Just the same way some babies suck their fingers. Sometimes it's the way some babies like to rub their navel and all that. Some of these things are habits, and we would not worry about it in a 1 year old. We will only worry about it if it continue to persist, or there are additional repetitive behaviors. So you've not told us now whether the child has additional repetitive behaviors. So if it's just the rubbing of the forehead alone, I will not worry about it. I will just monitor it for now. That's what we do. Okay, for toddlers with black spots on their leg due to insect bites, okay, what would you recommend to clear? It's nothing. It's she should clear by itself. Yeah, most of the time the body does clear those kind of spots by itself, because normally we change our skin a lot, so your skin, will keep changing, and hopefully with time it can go. Some people will use bow oil, use this, use that. From my own experience, most of the time it is just giving it time for it to clear by itself. But please don't go applying creams or things that will bleach the skin of the baby. Please don't. Just use your normal Vaseline. I think the most important thing is to prevent it happening again. So please make sure you wear them long sleeves and trousers, things that will cover the child's legs and their hands, especially in the evenings when they are prone to insect bites. Make sure the house is fumigated. Make sure you cut all the bushes. Just avoid things that can lead to those bites. But some children are prone to having these popular urticaria, as we call them. And but the good news is that they tend to outgrow them. By the time they're about 5, 6, they tend to stop having them, and most likely all those spots also will clear over time. They don't require any particular special anything to be applied to them. So I hope that's helpful. Okay. Instagram. Yeah, okay, yeah, we're on Instagram. Okay, yeah. So I think that's what to do. Nothing much to do. It will go. Just relax about it. I know sometimes it gets parents worried, but the good thing is to avoid the exposure in the first place, and hopefully it will clear. Okay, Oluwamayo can say your baby of 3 years old and knee bone is a bit protruded. Knee bone. Which of the knees? Both of them. Knee bone is then the normal position. I think knock knee. So knock knees is not the same as knee bone being protruded. Yeah, knock knees is when you have like Shizuke leg, they call it. When the legs is like K leg shape. We also have bow leg as well. So they are all sort of issues with the bone of children, and some of them are normal in front. In certain family they tend to have bow legs or K legs, and as the children gets older it will straighten and there's no problem. All right, for some children it is a sign of either rickets or vitamin D deficiency and all that. Whereas protruded bone, which is why I'm trying to know which one you are referring to, it's a different thing altogether. So you really need to know. So what I'll recommend Oluwamaya Omekun, is for you to take a picture of that. Like, make sure you don't wear trousers, because people send me pictures of children that they want me to comment on their legs, and the children are wearing trousers and socks and shoes. There's no way I'm going to see that leg. So you need to wear, you can wear a short or just the pants, and take a picture of the child standing in the normal straight position, front and back. You can put that picture on our Facebook group, then we can have a look. We have our orthopedic surgeons who can have a look, and they can recommend what to do. We can decide whether is this something they need to see, or is it something we can just watch and wait and see whether it will resolve on its own. All right, so but it's better for us to have a look. It's difficult to say whether it's normal, it's going to resolve by itself, or whether there is something more. The degree of how severe it is also help us to know. I usually would recommend just see a doctor first. Let the doctor have a physical look and make sure there are no other issues. If they are happy, fine. But if they think there are more, like doing some baseline calcium level and all those blood tests, and if it's all come back normal, we are more reassured. But if there is more, we may need to do X-ray, we need to do other things. So you can send a picture first, or you can also just see a pediatrician straight away. All right, you're welcome. Oluwamayokun. Okay, Major Eva saying, please, I don't know if you can recommend a good hospital in Lorry for me. Okay. So where was your baby being seen before? You said your child was being seen by doctors. So I guess that was where you were before. Okay. For Ilorin, usually for me, I don't tend to recommend privates because I don't know them. I'm not saying they are not good privates, but I wouldn't know. But the places I can always recommend is that you can always go to a teaching hospital. So for your child with the SS baby major, I will recommend you go to University of Ilorin Teaching Hospital, because that is where you're going to find the experts. I know government hospital can be very frustrating. There's a queue, there's a ways, and you don't like the way they customer care. But one thing you cannot take away from them is that you're going to get all the best specialists in any particular state will be in the teaching hospital. They will always be in the teaching hospital. Even if they have their own private, they will still be in the teaching hospital. So that's why I always recommend first to go to a teaching hospital. If you go to the teaching hospital and you don't like going to a government hospital, you can now ask those specialists there to recommend a good private for you, because then they will know their colleagues in that state that are reliable, So that's what I recommend. So for that, especially that your 2-year-old who is also overweight, I want you to go to University of Lawrence Teaching Hospital, see the pediatric hematologist and the pediatric endocrinologist, which is another good thing of going to a teaching hospital, because you have all the specialists under one roof. We can easily consult each other. We can easily send you to the other person and send you back. You don't have to leave the setting. So that is the advantage of a teaching hospital, a tertiary level care, and so that's the best place to see the specialist. Okay, so you have a newborn who is 4 weeks old. Your newborn baby does not need to go to a teaching hospital. Your newborn baby can go to health center for the immunization, so you don't need any special hospital for that. So just go to the nearest health center. When it comes to immunization, the health center is the best place to get your immunization in Nigeria, because the immunizations there are straight from the source and it's okay. So that's where you go. You can just see your general doctors and all that, but for children with specialist conditions, those are the ones that you need to go to teaching hospital for. So I hope you got the clarity. Okay, Oluwama is talking about the left knee. So that's very unusual for K legs or knock knees, or so if something is affecting only one knee, I would recommend you also see a pediatrician or the orthopedic surgeons, because that's unusual. If it is like the K legs and all that, it tends to affect both sides. So yeah. Okay, you were in Abuja before, all right. So Ilorin is not too far from Abuja though. So, but the other option is that whenever you are relocating, if you are with a particular specialist before you're relocating, always ask them to refer you to the specialist available where you are going, because that is very important. Oh, Mary, thank you for coming on Facebook. I was beginning to wonder what is happening on Facebook. Thank you, Mary, for being there. At least I know that nothing is wrong with Facebook now. All right. It could say, what is the fluoride per PM level we should use for toddlers? Okay, I know the dentists have a figure. I don't have it off my brain, but if you go to our website or our Facebook group and put that question there, somebody will cut and paste from the dentist recommendation. I don't know whether it's 1,000. I don't want to give you the wrong figure. I know the dentists have a figure for that, so you really need to check that. Yeah, so you need to check it. I'm not really sure of the exact figure off my head right now, but I know the dentist have one. But if you want to buy toothpaste for your children, go for the milk teeth toothpaste. So there are milk teeth toothpaste meant for children. So those are the type you go for. If you go for any of those reputable, popular brands, and it is for children, particular age, most of them would have followed the recommendation. Yeah, so I'm not sure I have it on my head, but please post that question on our Facebook group. I'm sure one of our moderators will know how to help you quickly find the figure from our previous teachings by our dentists, and then you will know what to do. Okay, Major Eva, say thank you very much. I'll have more questions. I'll leave it to next week. No problem. You don't have to leave your questions to next week. Just go to our Facebook group, post your questions there. I will answer them, or my colleagues will always answer your questions. So, but if it is not urgent and you prefer live and direct, of course, you're welcome to join us next week, Monday. But otherwise, you can post it on Facebook Monday to Saturdays. We will answer them. Okay, Ara Setina. Somebody told me that stem therapy is used to treat autism. Okay, so stem cell therapy as of today, 6:57 p.m. Nigerian time. Stem cell therapy is not a treatment recommended for autism. So there are a lot of people who are doing what we call trial and error research, and stem cell therapy seems to be nice, like steroid now. That is what is recommended for everything we don't know how to treat. People are just trying it the same way people would try things. But when it comes to treatment for certain things, there's what we call um recommendation. So we have to have what we call evidence. We don't just do things because somebody say, let me go and try this, it works. No, we have to have what we call evidence-based treatment. So stem cell therapy is not yet an evidence-based treatment for autism. So we don't recommend stem cell therapy for autism. I'm a developmental pediatrician. That is my field, as I work a lot with children with autism. So I can tell you confidently, as today, I can't say about tomorrow, since research can come out and things can change. But as today, we don't have evidence to recommend stem cell therapy, and I would not recommend it. Please, some of these people call stem cell therapy, telling you to take something they call stem cell. That is not stem cell therapy. Stem cell therapy is something very complex. It is something we use in treating cancers and other things. So they will knock off the child's whole bone marrow and put in stem cell. So it is something very, very difficult. It has to be done in the hospital. So I see a lot of adverts. People, I understand parents are desperate for solutions, and sometimes, people just say any rubbish. It's really these days with the internet, and people just follow and believe whatever they hear. But you will not hear the scientists say that, because before people will put in something as a recommendation, they have to do what we call research. They will have to do clinical trials. They would have to have tried it in maybe 100 or so many number of children, then come out and say, when we treat this set of people with what we call randomized control trials, when we treat this set of children and we didn't treat this set of children and we compare, we can see that the children that were treated, were actually cured or better than the children that were not treated. We must have evidence. That is how scientists come up with treatment recommendation. We don't just go by what we call anecdotal. Somebody said, I went for stem cell therapy and my child autism disappeared. Okay, one child. How many children have you treated with stem cell therapy that have autism? How many of them are okay? How many of them, So we need evidence. So that is how scientists work. We don't just work by sentiments or anecdotes. We go by hardcore, what we call randomized control trials. There must be serious evidence before such recommendation will be made, especially for something that is so invasive. So please don't go and pay for stem cell therapy for your child. Go and do speech therapy, do behavior therapy, ABA therapy. Those are the things that we know as of today that has worked and is still working. Of course, we don't cure autism, we only manage autism. So that's what we recommend. So please don't pay attention to it. Focus on what at least we have evidence that it works. All right, my time is up. Don't go to Turkey. Please don't go waste your money. Don't do that. All right. Thank you so much, everyone, for joining me. My time is up. I've got to go. But like I said, if you still have any questions, go straight to our Facebook group, Ask the Pediatricians. You can't miss us on Facebook. So go to our Facebook group, post your questions there, and myself, my colleagues, our moderators will be there to answer your questions. On Thursday, we have ATP Hour for teaching on one particular topic, and then on we'll see you again on Monday next week for another episode of ATP Live. Thank you so much for all of you who have joined me today. I'm especially impressed with Instagram people today. Amazing, amazing. I don't know what happened to Facebook people, but Instagram people really impressed me. All right, so have a wonderful evening. I'll see you same time next week, God willing. Just bye from me now. Bye bye. And if you're just coming, please go to Facebook group to post your questions there after you finish watching the video. Bye bye.